Hi again, everyone. In this video, I will be continuing my discussion of self-report measures, this time looking specifically at measures designed for depression. Again, if you haven't looked at the general video about self-report measures and general measures, I recommend you start there. And there's also a video about about anxiety. So this one's about depression. And if you suspect that your client may have a depressive disorder or a mood disorder, or the general screener indicated that, you should definitely consider using one of these. Okay, so here's a list of the depression scales that I'll be going over in depth in this video, and we'll jump right in. So first is the Beck Depression Inventory, which is a self-report measure of depression that consists of 21 items. It's appropriate for measuring severity of depression in adults and in adolescents ages 13 and over. The questions essentially ask clients to report symptoms for the past 2 weeks. So this one's a little different from some of the anxiety ones that we looked at that we're looking at 1 week duration. It takes roughly 5 to 10 minutes to complete, making it a nice, quick, and easy measure to use, and is available in many languages, including Spanish. This measure corresponds to criteria in the DSM-4, and each item is rated 0 to 3. If more than one answer has been selected by mistake by the client, you are instructed to choose the higher number. You would then add up the scores, which can range from 0 to 63. The classifications are provided below for what counts as low, moderate, or significant depression. Please remember, though, that even though this gives you a really specific level of depression, it's not a replacement for your own assessment and your own clinical judgment. Also note that response bias may lead some to exaggerate or to minimize their symptoms. So you want to go back and look at the specific items and be sure that you're following up with an interview. Okay, next is the Beck Hopelessness Scale. And this is part of it here that I've provided in a screenshot. Remember that hopelessness is an important indicator of suicidal ideation. So this measure was actually initially developed as a screener for suicide risk. It's not used for that as much anymore since the Beck scale of suicidal ideation has replaced it. And so now it's used to identify severity of hopelessness, which is part of criterion A for major depressive disorder. It consists of 20 true or false questions, which make it super quick to complete. And you give 1 point for each score based on the scoring sheet. In some cases, true equals 1. In other cases, false equals 1. So you need to look at the scoring sheet in order to interpret it correctly. And then once you sum up those scores, you would use the classification at the bottom there to interpret the score, with 0 to 3 being none or minimal hopelessness, 4 to 8 being mild hopelessness, 9 to 14 being moderate hopelessness, and over 15 being severe and a definite suicide risk. Okay. With hopelessness, in my opinion, any existence of hopelessness warrants further assessment and a suicide screening. So it's helpful to use this, take it seriously, look at the specific items, and go from there. Next is the Hamilton Rating Scale for Depression, and this is a 21-item questionnaire. There is also a 17-item version, so either one. This one, like the one for anxiety, is filled out by the therapist as opposed to by the client. So it could be done during the assessment as a clinical interview guide where you work through the questions and ask them aloud. Or after you've assessed the client, you could use it to score in a more objective way and kind of consolidate the information that you've gathered, whatever works better for you. Either way, once you've completed it, you're then adding up the values to get a score. So as you can see here, each answer corresponds to a certain number. And so you would add up the scores and then interpret them as a certain severity of depression. There are no cutoffs that I'm aware of, but it's going to give you how severe the depression is based on the number, with higher numbers being more severe. Oh, I totally messed up there. There's the scale for you there. Okay. Next, this is the Zung Self-Reported Depression Scale, which is a 20-item self-report measure. And just like one of the ones we saw, I believe, in anxiety, some of these are going to require some of these are reverse coded, meaning that they're going to require your scoring to be flipped. This is done to keep the client, again, from just picking the highest answer all the way down and not really thinking about what they're doing. And so you'll see like question 2, morning is when I feel best, most of the time is a good answer, which is going to have a lower score, versus for number 1, I feel downhearted and blue. If they select most of the time, that's a more severe answer, and it's going to have a higher score. And so you have to pay attention to that and use the interpretation sheet so that you score them correctly, and then you would sum them up. Okay, and so you can see at the very bottom of this page, it tells you which items are scored 1, 2, 3, 4, and then which ones are flipped around, with most of the time being 1 instead of 4. Okay, so then once you sum them, you get a rating of depression with normal, mild, moderate, or severe. And then again, you use your clinical judgment, you use any follow-up interviewing that you need to do, and you check for the specific items that were endorsed as high, and you use that to inform your diagnosis. All right, this is the last one that I'll go over, and this is the Patient Health Questionnaire, which is abbreviated the PHQ-9. This one's grown in popularity quite a bit since it's only 9 items, and it's been normed across several populations and addresses the majority of the diagnostic criteria for major depressive episodes. Scoring is fairly straightforward, as you'll see in this next slide here. Okay, basically you're adding up the scores and then using the interpretation chart here. Again, remember that the table is not a replacement for your own clinical judgment, so don't select, if the questionnaire says that the client has mild depression, but in your interview with them, they sound really hopeless and suicidal, that's probably not mild depression. So it's not a replacement for your clinical judgment and for what the client tells you in the interview, okay? Yeah, pretty straightforward, nice, easy. And most of these are going to be looking at symptoms over the past 2 weeks since we're trying to screen for major depressive episodes. Okay. All right, so that's it for depression measures that I'll be going over. As with anxiety, there are others that you may find, and you're welcome to use them if you have the training to do so. Always familiarize yourself with your measure in the event that your client has questions, and so that you know what you're providing and you can provide a helpful rationale for why they're completing the measure. Also remember that you can always use these measures as a guide for your diagnostic interview as opposed to having the client complete them on their own as a self-report. Whatever works best for you and for your client would be appropriate. Okay, that's it. Let me know if you've got any questions. The next video will be about screening instruments for other mental health disorders. Thanks, everybody.